Hey everyone, welcome back to the Walk to the Wealth podcast. If you're tuning in on YouTube or any of the podcast directories, make sure to do yourself one teeny tiny little favor and make sure to give us a follow because I don't want you to miss out on any of the amazing guests I got coming on today, especially today because I got a returning guest, which doesn't happen too often. So I want to give a quick little background on this guest. So I met her last year at one of the public speaking workshops that I was attending. Had a great conversation with her, chopped it up over dinner, and then invited her on the podcast. And then, of course, our good friend Technology decided to act up a little bit during our interview. So our podcast got cut short, like 30 minutes or something like that, 40-ish minutes or so. And so her episode is already out. It's just the first 15 minutes of the episode was the only thing that was cut. So decided to say, I reached out to her and said, hey, Dr. Julie, can you please come back on and kind of we'll catch up, see what you're currently working on. And so if you want to catch the first half of her story and how she got into what she's doing now, definitely go check out that episode. But in the meantime, Dr. Julie, for anyone who hasn't checked out that episode, give us your quick elevator pitch. Who are you and what do you do?
Yeah, thank you, John. I appreciate chatting with you again and getting in front of your audience. Yeah, so I have been a nurse for 45 years, 30 years at the bedside doing ICU, ER, trauma. I was 10 years on the helicopter as a flight nurse. And then I've been in nursing education for 15 years, which prompted the business that I created a year ago and have been building and working on. First time entrepreneur in all these years. And it's called LifeBeast Solutions, which is courses that I've created for the knowledge gap uh, for nurses, because I don't know if anybody's aware, but we have a healthcare crisis in this country where medical error is the third leading cause of death. So my solution was to create courses for nurses for training that may have missed or forgotten from school, which contributes to not recognizing when patients are becoming unstable.
Yeah, it's so one, you said that so eloquently. You were so put together. It's just like the mountain. It was only been what, maybe 8 months since we last caught up, and like it's dope to see how you were able to put everything get together since then. So kind of bring us up to speed a little bit. Because our original interview was back in November. Now we're talking again. It's currently the beginning of June. Um, what has gone, over that holiday season into the new year and the new year to now? Like, what's kind of taking place? What have you been working on? How did you kind of get to, I mean, you always had the same vision. Last year you were telling me about this, but it's so much more formed, I guess you could say, and put together. So like, what have you been working on since kind of like November when we last caught up on our original interview to now, and just kind of fill us in, bring us up to speed.
Well, the one fun thing, I mean, we shared a stage, a TEDx stage, which
Yep.
was amazing in Stamford, Connecticut in December, and that came out in January. So
Mm.
that was really one of my bucket list goals, and not because of the notoriety of being a TEDx speaker, but knowing that there's 42 million subscribers to TEDx.
Hmm.
And I thought, what better way to get this message out there so patients and their families understand the importance of becoming a part of the healthcare team, not just a passive receiver of healthcare. So that was amazing.
Hmm. And that was for anyone that doesn't know, our buddy, my mutual buddy, Brandon. He's a public speaking coach, and so it's so dope how the world works. He pretty much was like, you know what, I could help. He was working with one of his other clients, and he was like, hey Brandon, I really want to hop on a TEDx stage. And Brandon was like, you know what? Instead of me helping you get on a stage, why don't I just organize a stage myself? you know, so how that all came together was super dope. And yeah, for anyone listening, yeah, me and Dr. Julie got to share a stage, really dope, well attended. It was maybe like 100 people in the room that night. Lights was amazing. We're at a university campus. It's a university called UConn, which is literally like 7 minutes away from my house. So it's like I had kind of had home field advantage. It's dope, and I also went to UConn, the main campus, so it was really a dope experience getting to speak at that event and prepping for that event. And we're both shared something that we've kind of already been sharing for a while, but again, sharing it on that stage is it's a little something different. Being able to do that, say you've done it, and be able to get that reach from that platform. So you did the TEDx talk. You checked it off your bucket list. That was right before Christmas. I think literally a week and a half right before Christmas.
Right.
And from the new year on, like, what was kind of taking place in your life, in your business, and what have you been working on since in the 2025, the first half?
Yeah, so that experience was wonderful because it really pushed me outside of my comfort zone. And it wasn't speaking in front of 100 people that terrified me the most. It really was wanting to do a good job so that people would want to watch the TEDx, you know? So,
Mm.
yeah, I just got back a couple of weeks ago. I had another experience to speak at an event in San Diego.
Okay.
And this one actually pushed me outside of my comfort zone as well because it was the International Patient Experience Summit, which I ended up weaving some AI into my talk
There we go.
about patient safety. So, I had the opportunity and I thought, all right, I'll just research the hell out of this for the next couple of weeks,
Yeah.
weave it into my talk. And it was amazing. It really turned out really well. So, I created a care framework, which is about healthcare providers listening to patients. Again, that two-pronged approach to make sure that we're partnering and so we can decrease patient harm events. Because, as I said in my TEDx talk, communication breakdown is responsible for 70% of patient harm. So that's obviously a real big opportunity for us to close that gap.
Yeah.
So I made this care model and then connected it to AI in the fact of real time feedback, um, the real-time feedback, the connecting to the concern, made the whole acronym, but really having predictive analytics too that we can overlay into the electronic health record for patients at the hospital. So it
Yeah.
would send an alert if a patient has a QR code they can scan or they have a bedside tablet, they can say, "Hey, I'm really scared. My brother doesn't look right. Can you come and check him?" And it
Yeah.
would go right to the nurse's station, the charge nurse, and she would need to go in there and say, "Hey, what's going on?"
Yeah, no, that's dope. And for anyone that's kind of listening, was like, patient safety, and it still hasn't like clicked or like, imagine you took your grandma to the hospital and like she died because the nurse gave her the wrong medicine, like that, like things like that. And like you mentioned when we first started talking today, and in our last episode, that's the third leading cause of death. And so, what are the two? I'm assuming it's heart disease. I'm assuming and cancer.
And cancer.
Yeah.
Yeah.
So it's like it's heart disease, cancer, and then error, human error.
Yep.
That's
Yeah.
in the top three. When you think about it, it's crazy. And so that's dope that you're able to start, turn that into something. So hopefully for anyone listening, it makes sense now. And you mentioned you spoke on a stage and you got the care principle and use AI into it. It's gonna be dope to see because I was at a senior conference I spoke at in April. It was for senior real estate specialists, and they were talking about how the at home nurses for like elderly people, um after, in the future it's gonna be like AI, helping them with their stuff and like all that stuff. And they were kind of talking about the future of AI and in that space, and how they used to have like nursing homes, but like that's not going to be the same anymore because nursing homes are so expensive and so pricey and costly, that eventually, like in the future, it's going to be a lot of like AI stuff. There's still going to be people to help, but AI is going to be able to monitor, if they've fallen or if their vitals are off or and stuff like that. So it's interesting how AI is going to be integrated into the health
Everything.
space, and like of course everything. I went to the doctor, so I found out I have low white blood cell count, right?
Hmm.
And they were trying to figure out what is the cause of that. So we did some blood work and stuff like that. And so my primary care doctor, she showed me like the pathways that she called it, of like, hey, if you have low this, then check this and that. All right, if this is good, then XYZ. If this is not good, then ABC. And then each one, and she's kind of maybe breaking me down like the kind of like, I guess, the pathway, the thought process of how the system goes to check on some of these things. And it was just like, I mean, she showed me the printout, but I'm sure like the system did it in freaking, a couple seconds, and they just seen
Yeah.
all my blood work. So is interesting. So now that we're kind of up to speed with everything, you mentioned that you're working on courses for nurses and stuff like that. Like, how have you been kind of coming together and putting this all together? So what's kind of been your process? What's been helping you put all this stuff together? Because I mean, you have the knowledge, you have the expertise. A lot of people know a lot of things, and you're finding a way to turn your knowledge, your expertise into a monetizable business. And so kind of walk us through, because you mentioned, you mentioned your first time entrepreneur. Walk us through like the thought process of like what you had to go through to like come up with what you're coming up with now, and take the knowledge and expertise and experience that you have into a monetizable, sellable product, that you can go and now help other nurses and have even more of an impact with. Like, what's kind of been the thought process? How have you been putting it together?
Yeah, I wrote my book about a year and a half ago to help patients and their family. It's
Mm-hmm.
called Surviving Your Hospital Stay. To understand, if you have a family member, what should you ask? What is normal vital signs? What are my rights? Hey, my dad's going to the operating room. What do I need to know? And then I thought, okay, well, now what is an opportunity? Meaning, what is a gap that I can fill with my knowledge and my experience and my education? And that's when I came up with the idea for the courses. And funny you should ask, I just finished course number 28 yesterday.
Wow.
So, and they've taken a long time to do. I did hire two virtual assistants in the Philippines. One of them is doing the video part when I've written the script. For example, vital signs. I know it sounds really basic, but there's more to understanding vital signs with the pathophysiology in our bodies, et cetera. And so, creating enticing videos that nurses want to watch. And so the background of the videos are actually hospital scenes and nurses helping patients or looking at lab data or any of those things that are relevant.
Mm.
And each course is about an hour. I wanted to be able to give continuing education credits for that. But one thing that's happened recently is in the hospitals, there are education platforms where hospitals already buy access to these education platforms. And so I have a meeting on Thursday with one of the companies that's already in hospitals to do, I'm hoping, a licensing agreement.
Wow. That is big, because then you can sell that to at a corporate scale.
Yeah.
And for anyone that doesn't know, there's a lot of money in corporate, especially in healthcare space. And so that's gonna be very interesting to see how that all comes together. And well, talk to us about it. So how are you prepping for that? Of course, you don't have to get into like specifics, but like over like how are you prepping to get ready for something like that? Because that's a really big opportunity, and that's gonna allow you a platform to get some nationwide impact, maybe even international impacts. So like, walk us through like the process. How are you getting yourself ready for that meeting?
Yeah. Before I go there, you just reminded me of something else that happened this week.
Okay.
On my calendar for Memorial Day, there was an appointment that showed up at 9:30 in the morning. And I thought, I didn't block out my calendar, but everybody knows Memorial Day, nobody works.
Yeah, yeah, yeah.
But of course, me, it happened to be a guy from Germany who'd heard about my courses and wanted
Wow.
to talk about how can we make this happen and collaborate and partner. So that was awesome. So, John, you're going to love this. What I did was I took my first course transcript, had AI do a summary,
There we
and then
go.
translated it to German and sent it to him.
Hey, that's
It
how
was
you get
awesome.
resourceful. That's how you get
Yeah.
resourceful. So that's dope.
Yeah.
And then is that the same people that you're meeting with now? That was a separate opportunity.
Separate. Yeah.
Sheesh. So now you
So
got
when you,
two things that you're potentially working on coming up.
yeah. So that was really fun. I'm trying to expand how I think about things because I believe the universe delivers.
Yeah.
We just have to imagine. What's in our imagination is more real than what we're seeing around us, I believe.
Mm.
We create what we want that to be. And so part of that has just been visualizing what would be really like awesome and wonderful, to get this information out to as many places as possible because I believe that's what's going to save lives.
Mm.
But so to prepare, yes, I've absolutely used AI. I've said, what does a typical licensing agreement look like?
Mm-hmm.
How in healthcare. And they say, well, this is, typical. Would you like us to ask, like work on some questions for you? And I'm like, oh yeah, great idea. Thank you.
Yeah.
And one of the questions I wouldn't have thought about myself was, do they do the marketing? Because I think
Mm-hmm.
how it works is that the hospitals have a library of choices from this platform. Let's just say they pay, $100 per learner, per nurse, per seat, whatever, to have access to that platform. And in that, they get to, in that pricing, they get to choose 50 courses or
Yeah.
20 courses or whatever it is. So my question is, how do they market? Like, hey, we have a new, vendor on staff or whatever you want to call it.
Yeah.
Here's some new courses that are coming out. You may want to take a look at these.
Yeah, and because if there's 50 available or 30 they have to choose from, who's to say that they're gonna even choose yours or even see yours?
Right, right,
Yeah.
exactly. So I want them to be front and center, of course. And I think, with the theme of patient safety, everybody knows that patients get harmed,
Mm-hmm.
even if they don't know how many. I mean, healthcare providers and healthcare leadership know accidents still happen. And so,
Yeah.
and they cost money. One of the research papers I read a couple of years ago estimated that hospitals spend between 13 and 15% of their annual operating income on patient harm.
Wow.
So I've
It's
got
very
a
costly.
database. Yeah, I have a database, and I said, I have no idea what's an operating income for an average size hospital. And I looked in this database, and one I just pulled up in Austin was 88 million. And
Yeah.
so even if we're really conservative, 10%, not even 13 to 15%, that they spend.
So 8
That's
million.
almost 9 million, yeah, $8 or $9 million on the conservative side.
Yeah.
So why wouldn't they want to say, hey, number one, we've got to take care of our patients, meaning, our brand, our reputation is going to go down the toilet. I think you and I talked about this last time, but there's a website that I would love your listeners to look at. It's called hospitalsafetygrade.org. And you can go on and see the hospitals in your area. Just put in your zip code, it's free. And it's all a nonprofit agency, but it's all data from the Center for Medicare and Medicaid Services, and they're rating hospitals on safety. So the hospital ratings are A through F. If I were you, I would never, ever go to a D or F rated hospital. What's cool though, let's just say you pull up, Johns Hopkins or whatever, if you live in that
Yeah.
area, you can see their overall rating, A, B, C, D, or F, but then you can also drill down. There's 22 metrics. For instance, 5 are under the surgical. Like, is this hospital good at preventing blood clots after surgery? Are they red, yellow, green, like the gas tank,
Yeah.
So I think that's really important for people to know and understand. And again, it's about being empowered, educated, and then you can make decisions.
Sheesh. I'm on the website right now. Um thank
Crazy.
God. So the hospital that I go to normally, and which is literally a town over, and the hospital in my city are both A. So thank God
Hooray,
I live where I
hooray.
live. Oh my goodness. This is dope. I don't think you ever mentioned this to me. Yeah, this is
Mm,
crazy to know. I'm gonna look into this more. So for anyone that's listening that didn't catch that, hospitalsafetygrade.org, and you can go check it out. I literally am doing this right now while I'm on the podcast. Both of the hospitals near me are both A, so thank God I'm in good hands. And if I ever move, guess who's now checking for hospitals before they ever move to a new city? So that's really
yeah.
good information to know.
Here's one other thing I would suggest. Even if you have an A-rated hospital, I would still look at all the categories.
Yeah,
Just for example, if you're going to have surgery and the hospital you're going to has a red or even yellow, but especially a red category for postoperative respiratory infections
yeah,
or postoperative blood clots. What I would do if I were a patient is talk to the surgeon and say, I see that this hospital doesn't do a really good job in preventing blood clots. what are we going to do together? What are you going to help me so that I don't get a blood clot after surgery? And they should say, well, we're going to put you on a blood thinner post-op. We're going to put you on sequential compression device stockings that like squeeze your legs. We're going to make sure you're mobile early, walking around and up, sitting up, to prevent blood clots.
That is really good information to know. So, for anyone that's listening, definitely go check that out. I think I might have talked to you, Dr. Julie, off podcast, like in person when we've met. And I've been taking more of an active role in my grandparents' health, and I trying to help them go to their different meetups and stuff like that. So, this is all really good information to know, especially in the life chapter of life that I'm in now. I'm taking more of an active role. But all right, that's cool. That's cool. That's cool. So to bring it back a little bit, so you mentioned before that you had the licensing agreement and you were using AI to kind of help out with some of this stuff. Talk to us how helpful has AI been as a first time entrepreneur in getting your business from just a concept in your brain, an idea, a thought, into something tangible within what you said, it's been only like a year and a half or so, right?
Yeah, about 14 months. So to answer that from a one single sentence, I don't know that I would be in business without AI. And I say that because it would have taken me so long to do what I'm currently doing
Yeah.
because I'm a solopreneur. I don't have a team except my virtual assistants. So for example, I built the courses, the titles, the content based on what my experience, what I know are nursing knowledge gaps, for example. But when I ask AI, hey, what do you think of this? I don't, I appreciate the bigger picture
Mm-hmm.
and the way of stating things that sounds so professional.
Yeah.
What used to take me an hour to write a paper or more, now I can do the outline and say, hey, what do you think of this? It's like having your own editor.
Yeah.
It's helped with my website, it's helped answer questions. I don't even Google anymore. In fact, I just was writing a TikTok script for later today when I get home and I can record. And I was writing about the hospitals that have less nurses have higher incidence of patient harm, which makes sense, right?
Yeah.
But so in the article, it said something about, well, there's a lot of states that are now moving to mandated staffing levels like California. So I asked ChatGPT, I said, when did California implement that? And then it came up with, well, they started it in 1999, but it didn't take effect till 2004.
Mm-hmm.
And then I said, well, has it really decreased patient harm and increased nurse satisfaction with their jobs? And it refers to like four different articles and gives
Yeah.
me all the data that would have taken me hours to research on my own. It's amazing.
Yeah, it's dope. And for anyone that's listening, ChatGPT has a specific feature called deep research that you could use to pull actual, articles and publications that are accredited. And worst case scenario, it cites everything it pulls information from, so that you can go double check them if you wanted to and stuff like that. So that's dope to hear. And so, all right, I'm interested now. We're right now in June as the time we're recording this. From June to the end of the year, what are some of the things that you're cooking up to finish this year? I know right now as we're recording, you're about a week or 2 weeks away from a public speaking workshop that I won't be able to attend. I know you'll be at, but fill us in. Like, what are you currently cooking up? What's in stores? I know you've been getting a lot of growth on TikTok. Just kind of just bring up to speed. Like, what do you have planned?
Yeah, TikTok is really interesting because last June, almost a year ago, when I hired a business coach and, they knew about my book and whatever, it was funny. They said, well, to really spread your message, you need to get on social media and we recommend TikTok. And I'm like, I'm not doing TikTok. I'm not a
Yeah.
14-year-old dancing girl. But I started with 11 followers last July, and
Hmm.
that was my family. And I think Monday I was at 11,800.
Wow.
So, it's not like viral growth, but to me, that means I add probably 20, new followers every day, something like that. The people
Yeah.
really want to hear, what I'm talking about. So,
And do the math on that. Like, what's the percentage growth on that? Like, most people struggle to double in a year, and that's like that has to be at least like an 1,000x you for whatever the
11 to 11,000.
yeah, just so you know, so God knows how much of a big of a jump that is. Imagine trying to increase your company 1,000x every single year, year after year. Borderline impossible. But yeah, so that's super impressive growth that you've been able to do that in just a year, especially after being so like, so resistant to even get it started. So you got that going. People are starting to hear the message and really resonate with the West message a lot more.
I would also say about that is just be consistent.
Mm,
I don't think I've gone a whole week with missing, and I try to do 4 or 5 a week.
yeah.
And I don't do anything special. I don't know how to do special effects. All I do is talk to the camera,
Yeah.
and I pause it and then I get my thoughts together and then, talk my next paragraph or whatever. And I'm not funny. I'm just pretty straight up, whatever. So I don't do anything special. I
Yeah.
think people like the authenticity. But I think what I'm going to do next is that speaking exploration that I did for the San Diego talk
Yeah.
with really figuring out how to integrate more AI into patient safety in hospitals that can just overlay on the electronic health records.
Yeah.
There are companies out there already, but I think a perspective that I bring is one that maybe some tech companies don't know.
Yeah.
But looking at those things like predictive analytics, for example, when the nurse has 6 patients and she doesn't have time to go back and look at, we've entered vital signs. So now we're seeing some changes in the vital signs, and now the lab results are back. That AI predictive analytics can say, hey, you better go check this patient. We think they're, close to being septic rather than just an infection. And so they can start early interventions and really
Yeah.
make a difference in outcomes. So some things like that, I think, are
Yeah. And that may
next on
open up
my.
a door to consulting and
Mhm.
not just consulting hospitals, but consulting tech companies who are selling to hospitals and
Yeah,
honestly consult to both. Why not? you know, but definitely that could be
yeah,
definitely another big avenue because a lot of people, at least from what I've found, there's a lot of the people who are in tech forget that most of people aren't in tech. Like that's not how most of the world thinks. That's like super complicated. And it's funny because like I'm an AI coach, so people look at me and it's like, "Hey, John, like, you're the AI guy, right?" And I'm like, "Yeah, but I don't do any coding or programming or developing or any of that stuff. That's like super high level AI stuff. Like the people who are actually doing that, they're on a whole nother world." The only thing is that those people don't know how to talk to the average everyday person, generally speaking. Generally
right.
speaking, especially at scale to like become like a speaker or something like that. Like, so, but you having that insight is what allows, like for me, example, like me being a real estate agent, right, allowed me to really connect with other real estate agents, right? Even though that was for a phase, and that's not what I do actively anymore. But because I had that phase, I'm able to actually connect the tech to the people, and that's, I mean, you've worked 40 years, so like you know the industry inside and out. You can connect that to the tech, and then make it like make magic happen, you know?
Yeah. I think that's what's most exciting is not knowing what the future holds, but having this passion and looking at being open to receiving what the universe has to bring as an opportunity that I wouldn't have even thought about. It's an open opportunity to see what possibilities and what potential are. And like we've talked about or touched on already, is AI is here.
Mm-hmm.
And once we can get a hold of, and here's how I would apply it. What is the challenge? How can AI improve the workflows or whatever problem we're having? I know a lot of people are afraid of AI. I'm not quite sure why. I mean, I've heard some things, but to me, the benefit, like I tell people on my TikToks, don't go Google because you're going to get wonky information. Like I don't know, abdominal pain. You're going to get all sorts of wonky stuff. But ChatGPT allows you to put in enough specifics, and I'll give you an example. So there's a patient safety advocate who's been in the industry for a long time. I write about her experience in my book. She lost her husband because of a medical error, and her son. has cerebral palsy and could have had a normal life because of a medical error. So she went to the ER last July, and this has been years ago, so she's been involved for a long time. But she went to the ER last July because she had jaw pain, temporal pain, tooth pain, and, her husband says, "Hey, honey, your face is drooping a little bit on that one side." So she went to the ER and basically was gaslit. The doctor said, "Don't come in here and try to diagnose yourself. I think you're just being a little histrionic or whatever." And she was like, "What?" So they went home. We discharged her with like a pain medication. And she goes, "I know something's right." So she put in ChatGPT, all of her symptoms. And they said, probably Bell's palsy. So she went back to another ER. And the doctor said, "Yep, that's exactly what you got. And it's good that you came in, because if it's untreated longer than several days, you could have permanent facial droop."
Damn.
So that's powerful.
Yeah, and it sucks. I think she needs to go to hospitalsafety.org and find a better hospital, because it seems like wherever she's going seems to just hate customer service,
Yeah,
or taking care of people. That,
right.
I don't want to make light of the situation, but that's actually, that is sick to, see that a free AI tool gave her more help than what people who are probably getting
Yeah,
paid, somewhere north of six figures, uh, to help people, not help people,
yeah,
But yeah, it's gonna be interesting how AI plays a role. I think it has, for that space in particular. I think you mentioned something about you don't know why people are scared. I think the big reason why people are scared is that people aren't really scared of AI; they're scared of people, and people are making
mm,
AI, and we know what we're capable of. I think that's kind of where that's my prediction as to where the fear kind of stems from. Um, I think another big fear too is like a lot of people, if AI does everything, well then the people who are just figuring, getting by, you know uh just doing the bare minimum, are gonna be caught swimming with the tie, caught swimming naked with the tie down, as Warren Buffett says, you know uh
yeah,
and they're gonna be screwed, because like, well, if you're just gonna do the bare minimum, well, so can AI, and AI doesn't pay me, and it doesn't need to get paid, or doesn't need lunch breaks, or doesn't need time off or anything like that. And so it's like, it's gonna
yeah.
be interesting to see how it all plays out. But I'm very curious, said, especially as I'm taking more of a health active role in my health personally. I've been in PT for a little while now. My grandparents' health, and seeing how everything is playing out. It's gonna be dope to see. But all right, Dr. Julie, we've been catching up right now. We talked a little bit about what's been taking place since November and the new year leading up to now. We talked about some of the awesome things you got coming in store. You got a really dope licensing meeting coming up soon. You got maybe some collaborations in Germany coming up. Um, I said you're entering. So is this your first full calendar year technically as a first time entrepreneur?
Yeah,
What are
yeah.
what have been some of the best lessons that you learned so far, this year, in terms of like the reality of being completely in it, like for a full year
Yeah.
start to finish so far?
It's much more expensive than I thought.
Yeah.
It takes a lot more time than I thought. And so, if I didn't, my recommendation would be only do something you're really passionate about,
Hmm.
because that is going to help see you through the tough times. And yes, I spent more money than I really had to, but I also wanted to fast.
Hmm.
I joined masterminds, I hired coaches. You and I did the same speaking schools where we've paid a lot of money for coaches.
Hmm.
But I think hiring the right people, and you have to check around and you have to look, because I actually had three different speaking coaches, and there was a big difference in that.
Sometimes you got to shop
But
around. You
exactly.
don't know what you like until you try it, and you just got to be smart enough to know whether it's for you or not, and make the adjustment
Yeah.
quickly.
Yeah. And so you've got to be willing also to sacrifice your time.
Yeah.
Like I work my regular job and go home and write courses or, record TikToks or whatever. You really have to love what you're doing or know that it's for a passion, a purpose. Otherwise, you'll just peter out and then it'll be for nothing that you even started.
Yeah, no, 100%. I think 2024 was my first full calendar year, and like the highs were pretty high. Like I did some pretty dope stuff last year, but like when it got tough, oh my goodness, like I'm pretty positive. I got a pretty good like optimistic view of the world, but like there are some times, man, I'm just like, yo, I hate all of this. I genuinely hate all of this so much. But I'm glad that I was able to push through. To your point, like you have to find that thing, and maybe the thing that you're doing isn't the thing that you want to do, but you have something else that's helping you get by. Like for example, like podcast. I love podcast. I was just talking on the podcast before I hopped on this one. Yeah, I could do this forever. I just love talking to people. Especially, I get to meet a lot of cool people from a lot of different places and a lot of different walks of life. And like through this thing we called podcasting, I'm able to stay in touch with all you guys and like just have dope conversations. Again, I don't really let anyone on the podcast that I don't know. Like, so it's literally just me catching up with friends, literally, all the time. And so it's dope to be able to do something like that. And then as I figure out the whole AI business, it's been kind of tough, you know. Still, there's so many people who are just like, I'm doing this upcoming AI challenge in a couple weeks, literally from the time we're recording, right? And I'm calling a lot of people who registered and just kind of get a check in for like how they're doing and how they're using AI and whatever. And man, there's already been like I probably got in touch with like 10 people so far, and out of the 10, I think like three or so um, aren't really using AI at all, or they're just like I kind of use it, but like I'm just trying to I just want to learn some more, and it's like that's it. Like you could be using this for literally everything in your business and just want to learn some more. I mean, cool, I guess, but it's interesting that how slow to change like the industry that I'm in, like real estate professionals in general, like how averse to change a lot of them are. And AI has been out for maybe I mean it's been out since technically the 60s, but like ChatGPT has been out like about to be 3 years, and there's still people who aren't even using that, and there's hundreds of thousands of AI tools not available. But you know,
Yeah, it's pretty crazy. I'm redoing version 2 of my book because I wanted to take out some of the citations in the book chapters because it makes it hard to read.
yeah.
And so I've had obviously AI helping me, like, how does this sound? Could it sound better? And then I said, okay, well, that's enough for tonight. I'm tired. And it seriously writes back and says, sleep well, Julie. You've really worked hard. You're really making a difference. Your clarity and your blah, blah, blah. It was sentient. It felt like I was
Yeah.
like, oh, thank you.
Yeah, no, it's so dope. Yeah, ChatGPT tends to give you that boost you need after a long day of working, and so,
Yeah.
all right, Julie, so Dr. Julie. So, I guess I mean we asked the famous 5 questions last time, but because the last half of the podcast was cut off, um, I feel like it's okay that we ask him again. And maybe your answer changed, maybe you didn't, maybe you forgot what your answers were back then. So it'd be dope to ask. So I guess to kind of start off, question number one, what is the most impactful lesson you've learned in life?
Wow. I would say stand true to your North Star. Don't let anyone or anything pull you off track. And I would say that if you don't know what your North Star is, you probably do. You probably just need to sit down and think about it. What are your core values
Mhm.
and what do you want your legacy to be?
What is the most admirable trait a person can have?
I'm going to say kindness. You know, when someone, and I know this is a cliche example, but when someone is rude to a waiter or waitress, I just think that reflects a lot about who they are, their character as a person.
Yeah.
And I think we need a lot more kindness in this world right now.
Yeah. Rule number one for all the business owners listening or people in general, you want to learn a lot about someone. Take them out for dinner, right? Not even in like a romantic setting, but just take someone out to dinner. You could tell, I'm so glad I worked in a restaurant. I'm so much more appreciative, so much more grateful, so much better with people. I've never, we didn't have money growing up, so we barely ever went out to eat. I had zero etiquette when I went out to eat. And like working at a restaurant, it teaches you a lot. And so now when I go out, I pay attention a lot. I'm very observant. I mean, we've gone out to dinner before at the speaker schools, and so it's like I'm always watching everybody. I'm always sitting in the corner where I could see everybody and see how everyone's interacting, and I just take mental notes. Well, okay. And to your
Yeah.
point, how people treat the waiter, how people treat the staff, how people, act. it tells a lot about someone's character. And it could be
Mhm.
very easily to you can very easily like just go out. What worst case scenario, you spend out an hour of your life and 30, $40 on dinner, but at least that'll prevent you from getting into business with someone who probably isn't aligned with you at all. So yeah, second that point. Third question: if you had to change someone's life but only had one book to recommend, which would it be?
Mm. I love David Hawkins' Power versus Force.
Okay.
And I love that he talks about kinesiology and energy and then talks about the emotional scale too, from 200 and all those negative emotions. And if, we're not going to go from grief to joy, but if we can focus on that next step to get from, the lower energy levels and really that develops who we are,
Mm-hmm.
develops our character too. And when we can have gratitude and we can have appreciation for just being alive and breathing, I know it's that again sounds cliche, but it's so true. Um, really trying to strive to live in an energy where it attracts the kind of people to us rather than when you don't have that clarity, you get all sorts of riffraff coming out of your life until you've got your own kind of energetic boundaries. Does that make sense?
No, 100%. There's a lady at my church, and I think she battles with like depression. And like
Mm.
every Sunday at church, we always ask for like, hey guys, any prayer requests or any testimonies this week? And she always says, I'm just, thank God I got up this morning. And to your point, it sounds cliche, but there's people out there who are battling every day just to find the strength, the willpower to get out of bed. And it only sounds cliche because people don't really have perspective as to how harsh reality actually is, and they're probably comfortable with what they've been comfortable with for quite some time and kind of get accustomed to it. But that's not the norm. There's a lot of people that are battling every day just for what some may call simple stuff like getting out of bed, getting up to go to church, getting dressed, like things like that. For someone like that has depression, that is a major uphill battle. So it makes perfect sense. Um, next question. You mentioned legacy throughout this conversation a little bit. What is the legacy that you're working on leaving behind?
I want to really change the perspective or the landscape of patient safety. I mean, you've heard me talk. We've been battling patient safety statistics in the literature for 70 years.
Mm-hmm.
1955, the Journal of American Medical Association talked about the most common thing that happens in the hospital to patients is harm. And that's horrific. We're smart, we're intelligent, we're, capable. Why haven't we moved the needle? And so that's what I want my legacy to be is doing everything in my power with the gift of my education, the gift of my experience to really make a change. And, I can think small and hope I only save one patient's life, and that would be worth it. But if I can do more, that would be amazing.
No, 1,000%. It's always funny hearing people like, I could just help one person. I'm just like, I'm pretty sure that isn't what inspired anyone to get out of the bed and change the world. Like everyone who wanted to change the world wasn't dreaming about if I could just help this. Like it's okay. You want to help everybody? Say that. Like I want to change the world. I want to leave a mark. I want to leave a legacy. Yeah, I hear a lot. I feel like it's all the time. Like these podcasts and like I just got into business. I just want to help one person. It's like I want to help a lot of people. Who's just if you're in business to help people, who wants to limit it to just one? But
Well, exactly. So again, we talked about this, I think last time, and on my TEDx talk, of course, too, was the cuss words.
yep.
If that acronym can help somebody have the courage to speak up, that can save their family member's life. Hey, I'm really concerned about my dad, or I'm really uncomfortable with what's going on with my son. I'm scared.
Mhm.
Just that alone, um, I think would be hopefully enough to, empower people. And when people feel empowered, they can change the world too.
100%. And final question for anyone that wants to embark on their walk to wealth today, what is the first step you recommend they take?
I mean, I'm just going to call it faith. And that doesn't need to be, a church word, but having the faith that if you have the desire to do it, then you have the means to do it. Because I don't think God, the universe, whatever term you want to use, gives us a desire that we can't accomplish. And so having that, hey, if I've got this idea, if I've got this passion, if I've got this desire, then line up with it and you can do it.
100%. Dr. Julie, it was great having you on. For anyone really quick that wants to connect with you, because I should have asked this before, sorry. Tell us, where can we find you at really quickly? Where can we get your book? Where can we you tap in with your website?
Yeah.
And drop it really quick.
Yep. All my socials and then my website are drjuliesiemers.com or drjuliesiemers on TikTok, Instagram, etc. And the book's on Amazon, or you can link it from my website too. You can get it there.
All right, Dr. Julie, again, thank you so much for hopping on. I appreciate you running back the podcast again. And it took us 2 tries, but more catching up for us. So I don't mind it at
It was
all.
great.
So great having you on. And for anyone listening, thank you so much for tuning in. And I'll catch you in the next episode.